Hi guys, welcome to my channel. My name is Brianna Michaela, not Brianna Michael, even though it's spelled like Michael. My husband and my friends all call me Brianna Michael, but it is Brianna Michaela. So this is my first video, and I wanted to talk about just kind of who I am, why I got into nursing, why I chose LVN as opposed to RN for now, and kind of where I'm at with everything. With this channel, I would like to talk about anything nursing. So things that are going on in the nursing world, things that are going on in my program. This is my cat Cleo. She's a little baby. Yeah, so anything nursing, anything going on in the world that involves nursing. I even want to go over how I study for school. I am actually doing really well. I do have a little bit of a background in, not really nursing, but I do have a couple associate's degrees of science. So a lot of this was review for me. So keep that in mind because it's not super simple for everybody. And not that it's been super simple for me either, but I've had a much better time with everything. So again, my name is Brianna Michaela, not Brianna Michael. I'm a wife. I am a mother of two. I have a son and I have a daughter ages 3 and 8. So not vastly, but pretty big age difference between the two. I do work. I technically work 24 hours a week, but long story short, I mostly only work weekends right now as a monitor tech at a very large hospital in my state, really. Like I said, I do have a couple associate's degrees of science. I did go to a community college. It did take me about 6 years to get my associate's degree, which typically is done in 2 years. However, I did stop a couple years into it, probably about a little bit into it, to stop and do my medical assisting. I was just actually at the same school, not same campus, but same school I'm going to now for my LVN. I did my medical assisting there back in 2017. Best thing I ever did. Got me my job where I'm at now, and best thing I ever did. So that's a little bit about me. So why I chose to go the LVN route. So LVN was not my first choice. There is nothing absolutely wrong with being an LVN. You are still a nurse, licensed vocational or practical nurse. So the reason why I chose to go with LVN is because it's just extremely hard to get into an RN program where I live. I do live in California. It is mostly lottery system. There are a couple schools that go off a point-based system, but then it's still lottery at that point. So it's not like they take the first 1 through 50 that have the highest points and then there you go, because that's not really fair either. So the way that it is when it comes to getting into nursing school really isn't the best, I guess. I had great grades. I did all of my science classes. I did do them all online as well because that's when COVID happened, and I do have ADHD, so repetition, going at my own pace, going over things again, whatever I needed to do to really absorb and retain that information works really well for an online platform for myself. Not for everybody with ADHD either. So great grades. I did my T's, did really well there. I have work experience. I worked at my hospital for about 5 years now, and I have prior experience even before that, and it really didn't matter. I just didn't get picked. And I know I really only did one batch of applications, but that was kind of it. Like, they do recommend doing at least a couple of different attempts and cycles for applying to an RN program, but my husband and I, we decided that was it. I could not wait any longer. Been in school for 6 years. My kids were getting older. We just kind of needed to get the ball rolling. So I knew about my school's LVN program. I just decided to go for it because LVNs, especially at my hospital, make great money, and it could just help. That's all. It would just be kind of a backdoor way into my RN program because there are RN bridge programs, so LVN to RN bridge programs that you can do. And also the junior colleges in my area will give priority enrollment to somebody who is already an LVN. She's going to do that a lot. That's her spot. The LVN to RN route. You can absolutely stop at being an LVN. Totally fine. There's jobs out there. There's a lot of jobs out there. And if you are smart and you do it correctly, an LVN can actually make more money than an RN. Not everywhere. Not every case, but if you're smart about it, you can make some money. You can make some bank. So my goal, I will be starting my BSN program hopefully this coming August. Kind of making sure that, you know, everything pans out correctly, or pans out well, I guess. Why I myself personally wanted to get into nursing was because when I had my son 8 years ago, I was at the time living in a very small area. So keep that in mind, very small area. I am heavily tattooed. You cannot tell because I'm wearing long sleeves. You can kind of see through here, but I am heavily tattooed. And at the time, my gauges were much bigger. I'm actually going to be closing these up this year, so maybe I'll post a video about that. But anyways, I got judged pretty hard. So that had a lot to do with the care that I received in labor with my son. I have like a cat hair in my nose. Oh, I just got excited. I was excited to be in labor, excited to become a mom, and I was just treated terribly. And it was very evident that the nurses and the doctor were not in my, or I wasn't in their favor. They were looking down on me. They had a very different perception. Wrap all that up. That's really personal. So I decided that I needed to be part of the change. I needed to be in the position where I'm not going to judge you for what you look like, your background, whatever. You are here for care, whatever that care may be, and I'm going to give you my best care for you because you are here for a reason. So, you know, and being somebody that is heavily tattooed, and right now I have gauges, I think it'll help too in some cases when people that come in, they look like me and they see me in my role and they can kind of relate to me a little bit. I think it might help them, you know, and things are changing. It's 2023 now, and tattoos are widely accepted everywhere. So that's part of why I wanted to become a nurse. So let's talk about LVN versus RN. Right, both nurses, licensed vocational nurses, that's what they're called in my area in Northern California. I know some other states are called LPNs, licensed practical nurses, and then registered nurses. So for LVNs, typically the program is about, mine is a year. They say it's accelerated, whatever, but typically it's about a year. So just for the certificate, because I'm not going for a degree, but you can get a degree, associate's degree in licensed vocational nursing, which is about 2 years. So the LVNs, we go in, we do our program for about a year. So some of the classes, like fundamentals, which is where you learn simple things like, well, I guess it's not simple because hand hygiene, which is huge, and chain of infection, and asepsis, surgical asepsis, things like that. Bed baths, how to make a bed, how to miter those corners, whatever. There's debate about, do you miter just the bed sheet? Do you miter the bed sheet and the comforter? Is that a restraint then for your patient? Like, it's very technical. Everything matters. Learn how to insert and remove Foley catheters. You learn surgical wound care, how to clean those properly, how to take care of them properly, sign everything. You learn a lot of documentation. You make a lot of nurses' notes, which is actually really important. And the better you get at your nurses' notes, the more time you will save. And we all want to get out on time. We don't want to be staying an hour after just to chart and do your nurses' notes and blah, blah, blah. It's very important to be concise, but cover all your bases. Because if you didn't chart it, you didn't do it. And that's a legality issue. And we'll get into that maybe in another video. You have Med-Surg 1, which where you learn about a lot of disease processes. You have anatomy and physiology briefly because you should really have done that prior, which I did. So going into my A&P section, got it no problem, helped a lot really with everything. So I was pretty prepared coming into this program. You have maternity and OB, which in my program was very short, it was very brief, just because in my area LVNs aren't really utilized in the labor and delivery world too much. It kind of just depends on where you live. Because I know in Southern California and in some places here in Northern California, very rural, very up north, LVNs are utilized in the OB. It's just not where I am. I'm in a big city, so there's plenty of RNs to do that job. Then you have pediatrics, which is where I'm at now, and it's really inundated. And even though I have children, I have taken a human development class, and I've taken psychology, a couple classes of psychology. So some of this wasn't brand new information for me. It's still a lot because you have to think about where they're at in the scheme of things, developmentally, cognitively, and then how you're going to approach them, and it's a whole thing. It's a whole thing. That's why it's a specialty. And we have gotten a little bit more time. Yeah. Or is that the same for maternity OB? I don't know. Feels longer, probably because we're on break and it's kind of carrying over into the break. But pharmacology, which in my program isn't super in-depth. You do know some classifications, you know some medications, kind of like the most used medications and adverse effects and how you're going to monitor those things. You have Med-Surg 2, which is where I'm going into next after, technically I already started, blah, blah, blah. That's the whole thing. But Med-Surg 2 is just more of Med-Surg 1. It's more in-depth and it's just more larger system disorders all together. And mental health, which I haven't gotten to yet, but it's very important. It's very important. We need probably more mental health education as a whole in America, I think. Anyways, so then once you have done all those classes, you've matriculated through, you've maintained your GPA. In my program, you have to maintain a 75% grade point average, whatever. You have to maintain a 75% throughout each term. My school has 3 terms, and so if you get below 75%, you're booted, you're out. You have to restart, which is a whole thing. You have to wait until the next class that comes around, like you jump in on time, whatever. As long as you are matriculating and you're doing your work, you're not procrastinating, and you're managing your time well, and you'll be fine. You can pass on. So then once you're done with all of that, you have your exit exam, and then you take the NCLEX. And luckily, we'll be doing the next gen NCLEX questions, which I've had some practice. Well, actually, I've had pretty good practice. We are starting to really implement them in our quizzes that we have. And so I've been doing them for a while. So they're actually kind of like the cases that you get. You have these little tabs and you click through and you just to kind of see how the case progresses, and has all the information, and you have your questions on the right. And sometimes, especially with my ADHD, I get hyper focused. I tunnel vision in. When I'm reading these cases, I start getting super invested, and I'm like, wow, what happened? Are they okay? What was the resolution? And I think that's part of being a nurse too. You want to find out how things progress and how they resolved, and just kind of like if you got the idea, if you got it correct. LVN, summarize, it's about a year. You can get a certificate, you can get an associate's degree, you can work in skilled nursing, which is where LVNs are utilized pretty heavily. Emergency rooms, depending, urgent care for sure. You can do some outpatient surgeries, you can be a school nurse, you can do wound care, and you can do infection control, which is actually pretty cool, especially because, we just had COVID and, for RNs, right? So RNs, you have to get a degree. There's no certificate like LVN. You have to get your degree. The 2-year nursing RN degree is an associate's degree, associate nurse. Same classes, basically. You'll have some extra classes like critical care that LVNs don't do, because you can potentially work in like ICU and have these really critical patients in acute care settings. So you will need to take those classes. Like I said, they can work in acute settings, which is the hospital, inpatient, outpatient as well. They can do dialysis. They can also work in assisted living facilities. Typically, there is like 2 RNs, depending how big the facility is, that overlooks the LVNs, and the LVNs overlook the CNAs. So it's like a whole ladder, essentially. Ladder command, chain of command. RNs, like I briefly mentioned earlier, can also work in ICU, PICU, NICU, all those kind of intensive care units. And then they can go on for further education. They get their master's degree, they can get their doctorate, things like that. They can be a teacher. LVN you can't do, but you need your master's degree for that. So my program that I'm at. So I'm not going to name my program yet until I graduate, just in case, because I don't know what legalities there are about social media, talking about the ins and outs. I'm not going to talk about the ins and outs, but I'm going to touch on how it works in my program. And then when I graduate, maybe I'll do like a whole thing about how my school works. My program is 1 year. I'm not, like I said, I'm not doing the associates. I'm doing the certificate. I'm getting my NCLEX, my license. After I pass the NCLEX, getting out, going on my RN. My program right now, so in the beginning, it was Monday through Thursday, and now it's Monday through Friday. My clinical days are Monday, Tuesday, Wednesday. They start at 6 a.m. They get done at 2:30 p.m. And then I have theory on Thursdays and Fridays from 8 to 5. And then I work on the weekends as a monitor tech. So it's a little exhausting, especially when I have kids, but I have a great husband. I have a great support system. So it works for me. My school works in terms. We have 3 terms, first, second, and third. And each is roughly 14 weeks long. You get a break, typically 1 week in between the first term and the second term, and the second term and third. And right now we're actually on Christmas break, so that's really nice to have 2 solid weeks off where I have done nothing. I was really sick, so I just kind of vegged out on my couch. My kids were sick too. My husband was a little sick, so we were just super lazy, and it was the nicest thing ever. I didn't go to the gym. I think I turned my Roomba on a couple of times, picked up the house. Once it was Christmas, we're all just exhausted. So each term there's minimum 20 quizzes each, and there's projects, there's CMSs, which is like content mastery something, and it's like midterms basically, and finals and things like that. We have tons of presentations. We have sim labs where we go in, we have the mannequins, we do a whole simulation. We have charge nurses, primary nurses, lab tech, all this stuff, and we just kind of run things. And I actually like that a lot. I've learned a lot that way. So that's very helpful, that hands-on approach, especially if you have ADHD like I do. It really helps to get in there and just get hands-on, because then you're starting to connect those dots in your head. You're applying what you see, what you know, and then seeing it kind of in person. It helps a lot, and I wish we just did that the whole year, honestly, or at least like half the year, because I think that would help everybody really retain that information, apply it. Because a nurse, what you need to know how to do is your job. You need to know how to do your interventions and your assessments and all those things. So having the time and the place to do that has been phenomenal. And then we have these capstones, which actually a lot of schools do, I guess, but I guess every school is a little different. And then every nursing program in the whole world apparently uses ATI. ATI is what I did my TEAS exam on, so I was a little familiar with the layout and how it kind of works and blah, 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 but it's a whole different ballgame when you're actually in nursing school. You have all these exams, which are the CMSs, then you have, that's where your quizzes are, and you have these modules you have to do. And really, everything you need to be a nurse is on ATI. You can find it on ATI, and it has the most updated information, and I actually really do like it. And after that, you are good to take the NCLEX. And if you don't know about the NCLEX, it's the National Certification Licensing Exam that everybody who wants to be a nurse has to take. And the same thing for whether you're an LVN, if you're an RN, it has a minimum of 75 questions, cut off maximum, I believe, like 145. So like I said, I will be starting my BSN in August, and I'm going to film that whole journey, talk about that as much as I can, kind of take everybody along with me. I didn't feel like there was a whole lot out there on YouTube that had just like help me, you know what I mean? Like, what am I doing? What am I getting into? What am I looking at here? So I think I'm gonna try and do my best that I can to show you guys my journey for that, and help out anybody else who's thinking about being an LVN, being an RN, doing LVN to RN, whatever the case is. And my biggest takeaway from nursing school, like I said, I have been doing really well. I have failed a couple of exams. It's just that statistically is going to happen. There's so many exams. There's no way you're going to pass every single one every single time. Flying colors, whatever. You might squeak by. You might vomit. You might get 100%. Happens. I haven't. Don't need to, because it really doesn't matter at the end. As long as you passed, right? You passed your English, you get your license. Your new job isn't going to ask you what your grades were. So as long as you pass and you know what you're doing, you're a safe and competent nurse. That's the most important thing. Like I said, pretty well the whole time, even with work and kids and a husband and all this other stuff on top of it. But time management has been my biggest number one thing. And I will be making another video about how I study, especially with somebody who has ADHD, and I am not medicated, so I'm just free ball on life here. And so time management has been my biggest thing. So if there is an assignment that has been released, I will do it as soon as I can, as soon as it's open, as soon as I have the materials, whatever it is, I will do it. I will get it done. I write it off my calendar and I move on, because we have so many exams, so many other things that we need to do, that I need to delegate my focus and my time where it's needed the most. And if I'm putting things off and it's piling up, then when I get to that point, I'm going to be SOL. If I can stay ahead of the curve, stay ahead of the rush as much as possible, that helps me out the most. And I've listened to my other classmates who do the opposite, and they wait, and then they're slammed and they're stressed, and oh my god, this is so hard, and blah, blah. And I'm over here just like, I got that done 2 weeks ago, and I'm studying for the CMS or doing my capstone or whatever it is. So that has helped me out the most. But you know, it's definitely doable. It's doable if you need to work, because I can't just quit my job. You know, I have fantastic insurance, and I am using where I'm at now as a monitor tech to help me get a job at my hospital later as a nurse. So I need to hold on to my job and keep my managers happy and do everything that I need to, so that I can capitalize on all my work and all my effort later. So I couldn't just quit my job for my LVN program. But it is doable. And if you have a strong support system like I do, my husband's fantastic, his mom, my mother-in-law, my sister-in-law, they have all been really helpful to try and help me get through my program. I do have some extra resources through my job, because we are a union. A lot of programs that they offer employees through my hospital, if you are unionized, to go back to school so that you can be successful in your program. So I have had a lot of things work out for me in my favor. I have. But I put in the work and I put in the time to make sure that I have those resources available to me before I started my program, so that I could be successful. And now I'm about 2.5 months away from graduating, and I'm still working. My family's happy. My kids are well taken care of. My son's gonna be starting lacrosse in March. Like, oh no, his practices start February. His games start March, which is great because I will be graduating in March. So it's totally doable. I've gone to my family events. There's been plenty of things that I've had to say no to. Like, I can't go out to dinner. I can't go out to have family dinner, whatever it is. I can't make this birthday party for my niece or something because I need to study. And it just is what it is. So there will be sacrifices you do have to make. It's not super easy peasy, lay back, just whatever, because then that's kind of nurse you're going to be. If you even become a nurse, if that's the mentality that you have. It is hard work. You need to do the work. And you need to learn the information so that you are a safe and competent nurse. That is number one. Our patients are number one. So keep that in mind, and let me know if you are an LVN, if you are an RN, if you're thinking about becoming an LVN, think about becoming an RN or doing some kind of bridge, or if you want more nursing tips or study tips or anything like that. Like I said, this is my first ever YouTube video, so I'm still kind of figuring it out here. But I do want to cover anything nursing school, working as a nurse. I don't know how much I will be talking about my job as a monitor tech or anything, or taking you guys into the hospital with me, because patient privacy is number one, and I'm not 100% sure on what the policies are at my hospital regarding social media and reporting on the premises or anything. So I do have to keep my job. But we'll see kind of where we go. But let me know down below in the comments, and like and subscribe. Thanks.